Healthcare is not just about the money. It's not business. It's people. Every number that we display to say, oh, we have XYZ number of patient enrollment. Those are human lives, But we have more people who are in this space that just see those numbers as opposed to human lives, and that is where I would say most of the issues stem from.
Most people can tell you what should be fixed. Far fewer can explain why fixing it is so difficult. My guest today has spent years working inside healthcare, one of the most complex systems in Africa. And what he's learned extends far beyond healthcare. It's about progress, it's about implementation, it's about why knowing the answer and creating change are often two very different things. Femi, I'd like to welcome you to the lens. It's really great to have you here.
Thank you very much, Charles. Nice to be here.
Amazing. And I know that we've got history, but today is not really about that. There's a part of your life that, we haven't really had the chance to talk about. And I'm glad that, we are having it on the pod today. And I would love to start at the very beginning. How did you get into healthcare, Femi? What first drew you into it? How did that decision happen?
Okay. All right. I would say I would say it's been a long time coming. Even though some of those decisions were not conscious. Growing up, looking at Nigeria, looking at the healthcare landscape in Nigeria, I've always known that something was wrong. And even personally, with some experiences with the hospitals, the primary healthcare centers, and even private hospitals that are already set up, right? I could still see that there are some information or there are some things that are lacking, right? And when the opportunity came for me to do something about it, in terms of applying for a job in healthcare, I took it, right? Of course, initially I did not know the scope at which I'm going to, be working, but for me it was all passion, right? It's the fact that I'm doing something that is meaningful and something that would, impact, outside of who I am, outside of, my own self. And healthcare was it for me. And so far, I'll say it has been a very interesting and rewarding experience.
Has it though?
Oh yeah, yeah, it has. In terms of the learnings, I would say, in terms of the access that's given me, in terms of the exposure I've also gotten, I would say yes, it's been rewarding. Very, very rewarding.
Amazing. Like you, most of us, especially because we have African origin and we are Africans, Nigerians specifically, we have broad ideas of what we think are the problems with healthcare in Nigeria and Africa at large, and our criticism is often shaped from our own understanding of what the problems were or
Yeah,
challenges were.
yeah.
For you, what were your thoughts around these problems before getting into healthcare?
Oh yeah, I mean, the first thing on my mind is I could not understand why my mom would wake me up early in the morning to go join the queue to access healthcare. And this is for children who grew up in the 90s, early 2000s in Nigeria. And I think it applies across Africa as well. You would know what I'm talking about, right? The fact that you have to wake up so early, you go to the hospital is jam packed, and then you have to spend the whole day basically just to see the doctor and access care, right? So that is, for me, that was the one thing that stood out. You know, that was the one thing that stood. I didn't even know anything about self medication. I didn't know anything about, it was just that I dreaded going to the hospital because of that. Apart from the waiting time, you also have to smell all the antiseptic and everything. The hospital environment themselves are not really so, hygienic and not so. Of course, that impacts on the kind of experience that you're going to get from it at the end of the day. So, my understanding of the challenges in healthcare were mainly from a patient standpoint, a patient experience standpoint prior to me joining, right? Looking at medications, for example, I don't really know what I'm taking. If a doctor prescribes something for me, I just trust my parents or trust that the doctor is telling me the right thing and I just take that medication. So from a patient standpoint, I could also see that there are a lot of, gaps that could be filled. And that was the lens in which I was looking at healthcare from before, going into the space itself.
Awesome. And I know that this is probably one experience, and there could be many more of what you had seen as, that it had the problem or parts of the problem. But my next question really is, what did you think could make or will make the biggest difference going in? So you had a perception of what the problems are. You had probably at some point critiqued either healthcare workers, the healthcare sector, or the government in general. And so going now, you're going to work in healthcare. What did you think would make the biggest difference?
So for me, it was like I said, my view, my lens was shifted from a patient standpoint, right? So I'm going in looking at all of the challenges that patient experience when they want to access care, right? So patient
Yeah.
waiting time is one of the things that I mentioned. Accessibility of care, and even medications is also another thing. Information about their medications or about their illnesses is also another thing. So those are like the things that I had at the back of my mind. So, okay, can we have, you know, an interface that can allow patients to easily access care, that can allow patients to easily find medications, that can also allow them to understand, have access to their medical records and also understand, what all the information in those records mean to them and how it translates to their health. Of course, it's this information that is going to help them, translate into how they are going to live their daily lives and ensure that they're more health conscious and whatnot. But upon going inside, I realized that you cannot solve the problem for patients without solving the problem for providers, right? You cannot solve the problem of access for patients without solving the problem of internal operations in hospital or how hospitals actually operate internally. Because part of the patient waiting time you would see, or part of the things that contribute to patient waiting times in these hospitals, sometimes could be something as simple as an inefficient system. Let me give you an example. You have a nursing station here, and then you have a doctor's station that you have to walk like maybe 200 steps, to go there. And this hospital is working or is operating basically paperless. So what that means is if a nurse takes the patient's vital from this table, she has to physically take that record, you know, walking 100, 200, 300 steps to the doctor's office to present that information to him. That in itself is attributing to the waiting time. You understand? Or a
Okay.
patient walks into the facility and then it takes like 3 minutes or 5 minutes for the healthcare record officer to pull in the information. So those are things. So I now realize that to solve the problem for patients, we have to solve the problem for providers. We have to solve the problem of efficiency in how these things run. And then we also have to solve the problem of communication between these providers themselves. So I
Okay.
think when
So
we when we
typically,
continue to advance in this conversation, I'm going to buttress some of these points I've just mentioned here.
okay, so essentially we had a severe record management problem, but also being able to exchange that, access that information in real time for healthcare providers. That's interesting. But also, was there something else beyond this that surprised you the most when you got in?
Surprising, I wouldn't say surprising. I would say eye opening.
Okay, tell
Yeah,
me.
I would say eye opening. And so yeah, so in trying to solve these problems, right? Trying to solve the problem of access of interoperability for doctors, for giving them access to records and all, we also realize that infrastructure is the main problem. You can build the best AI powered system with a very nice UI, and you bring it into healthcare, take it to the hospital, and the doctors tells you, oh, we don't have power to even turn on the laptops to use your system, or we are running an internet that is running at maybe 1 or 2 Mbps, and these things, affects whatever digitization efforts that we are putting in place. And there's also the culture, and that's also another thing that shocked me. Like, human beings are adverse to change, right? So if you're bringing in something new, you would naturally get that friction. So I think that is also another thing that I would say was an eye opener. How much, you know, or how I don't know the best adjectives to use to describe it, but
But let
how.
me come in here. But just stressing on that point again, and I think you're describing a people problem that is in healthcare, and some
Mhm.
of those could include cultural context, belief systems. Like I've heard stories about people who would potentially decline things like blood transfusion, I'll
Mm-hmm.
have people that, probably and in orthopedic scenarios where people have broken bones, they would prefer to go to local bone center than go get an x-ray and understand the level of damage. So and I think my next question to you would be, how much of healthcare problem in Africa is a people problem rather than a healthcare problem? How much of this problem is a people problem?
I would say that majority of the problem in healthcare is a people problem than and by people I mean that it is people that are behind everything. Infrastructure, for example, is one of the major issues, right? But it is still people that are in place. What do I mean by that? There are a lot of interventions or a lot of funding, especially in like primary healthcare settings, to ensure that this infrastructure are in place, right? Solar is in place for this facility to cut power. You have maybe a local server in place in these facilities to curb the internet downtime and all. They are already funding in place for these things, but you still see people in between that value chain, that kind of frustrate those processes, because of some reason or the other, right? So I would say that majority of this is just one example, and also from the healthcare workers part of it, there is the okay. You're coming up with a nice solution as a young man. You've thought about the problem in healthcare. You have a solution for it. You introduce it to, let's say, a CMD of a hospital. He sees the value in it, but tells you, "Oh, how does this give me more money?" Right? And if they cannot see how this immediately translates to direct revenue for them, it's pushed to the side. So the fact that people also cannot see the use of these technologies or having like a digital healthcare delivery system, as an investment, is also like another issue. There's also, from the healthcare workers part of perspective, right, where you bring in a solution and they tell you that this is also another project that is going to come, and after 1 year or 2 years, it becomes obsolete, and then you bring another one. So these are like the cultures that are entrenched, in healthcare delivery. And there's also the part of this is the one that even affects us the most, right? Especially in like government institutions. The fact that there are very little staff, very little healthcare workers, and as such, you can have a facility where you have people who are trained and then they understand how to use this system, they understand the importance of healthcare, of digital healthcare delivery and all of these things. But because there's a gap in workforce in another facility that is not digitized, that person can be moved and transferred to that facility. What that means is whatever information or whatever knowledge that they've learned in a healthcare facility that is digitized becomes obsolete in wherever they are. They have to go back to learning how to use. They have to go back to using paper and pen to attend to their patients. So that same person, if you go back to them to say, oh, okay, we've brought something else to this facility for you to use, they would be kind of adverse to it, to say, hey, what I will learn now, and then next time I no longer work here. And even in the private hospital settings, right? Because people who are in most of the people who are working in healthcare, I will not say I don't think this is also a healthcare thing. I think generally people are financially motivated. So even in the private space, you're working in a hospital, and then you see an hospital that's going to pay you more than where you are. You immediately you jump ship. Whether a doctor, a nurse, or a medical record officer, you immediately jump ship, right? So majority of these things, are people issue. But I can also then link everything back to government, to the economy, because why would someone move from one hospital to the other? It would be, in search of better, greener pastures. Or why would someone who has access to funding, to ensure that there are some infrastructure in place to ensure things are done properly, pocket it? It's a corruption issue, and it's also an economic factor at the end of the day. But I'll say majority of these things is, if we really are going to solve anything in healthcare, it must come from an individual standpoint. It must come from people changing their mindsets on how they approach it and how they even see healthcare. Healthcare is not just about the money. It's not business. It's people. Every number that we display to say, oh, we have XYZ number of patient enrollment. Those are human lives, But we have more people who are in this space that just see those numbers as opposed to human lives, and that is where I would say most of the issues stem from.
Femi, and I've got an interesting question here, and for me, it will be, is it necessarily wrong that people who work in healthcare are financially motivated?
I would say it's a yes and a no. It's
Okay,
it's
walk
a
me through
no.
that.
I will start with a no. I'll start with a no because of there's something I put out on my WhatsApp status a couple of days ago. I said in an unjust system, right, the just becomes the butt of the joke, right? So if you're working in a society that is financially driven, if you're working in a society where money is the new god, and then you're coming up to say you're holding up to a particular standard, it's going to look like you're just high on your horses and you're not seeing the reality of things, right? So from that angle, I would say I would not judge anybody who is financially motivated in healthcare because they are a factor of their society, their environment, and what is available to them, at that point. But if you look at what the ideal should be, if we take it to what the ideal should be, a medical doctor before he becomes a medical doctor swears an oath. You know, there's a reason why healthcare as an industry is heavily regulated. Because for me, the most important thing is health, health of an individual and health of a population. Charles, if you have toothache today, you will not be able to do this podcast. You understand me? You will not be able to do this podcast because of that toothache. So the fact still remains that if things are done properly, if the funding is used for what it's supposed to be used for, if healthcare is subsidized the way it should be subsidized, if healthcare workers have dignity in the work that they're doing, then there won't be any need. In fact, if anybody comes to tell me that I'm jumping ship to hospital one to hospital two, it's going to be very glaring that it's a selfish situation, right? It's a selfish move. But because of where we are currently, it makes it very difficult to judge anybody who is financially motivated. So that is the dilemma I would say we
So
have.
this is an ethical quagmire. And is that one of the reasons, or do you think this is a reason why good ideas struggle to become reality in the healthcare
Oh
space in
yes.
Africa?
Oh yes, 100%, 100%. Because you can. I was part of a roundtable discussion where a young man came up and was like, "Oh, they thought about how they could ensure that in the case of emergency, they have like a detailed workflow that can be used by a general hospital." And they approached this hospital. In fact, they designed it. Everything looks good. They approach the hospital with it, and they're like, "Okay, this is what we have. This is how it's going to work for you," you know. And the management of the hospital kicked against it. Why? Because it's going to expose some of their practices. And by
Okay.
practices, I mean maybe you administer some medications that you should not have administered because you have a quota or you have a quota to meet, or something, right? And this is something that they will definitely kick back again. So that young guy with this idea, what he has built, cannot implement in that facility. Of course, he has to now start, going to other places to see where they can adopt, which is an issue. And even in shopping for facilities where they can adopt your solution, you get in there and there's a structure in place. There's a structure that pays someone. There's a structure that pays a particular institution at the end of the day. So whether it is whatever it is you're building, if you do not say, for example, you want to build, you want to start, you have an idea to start a business here in Lagos State, the first thing that you have to contend with is NDPR. You need to ensure that you are NDPR compliant. And what it means is not just someone coming to look at your system and then give you a certification. Is money. You have to pay for it. If you're working in healthcare, whatever information that you're gathering for Lagosians has to route to the state government, which means you need to get clearance from the state's Ministry of Health, Innovation and Technology for you to run what you're doing. And right now, again, there is now an intentional agenda to ensure that all healthcare apps are integrated such that every information flows into a central, every data flows into like a central database, right? That can be used information information emergencies and disease surveillance and all of these things. So it means that for you who want to start a new business, you have to think about how you're going to integrate with that system. I think it's called SHIP or so. state health integration platform also. So all of these things are like the barriers I would say are that would discourage anybody who wants to do something. But where there's will, there's a way. I would say.
I mean, in your opinion, you would think that, embracing digital literacy and overall digitization of, especially key aspects of the healthcare system would help curb issues like, of unethical practices, some of which you've
Yeah.
described
Yeah.
on this conversation.
Yeah. Yeah.
Talk to me about some of those digitalization projects, and some of it you probably are part of them, and even if you're not part of them, just talk to me about key example of that, and what it looks like, and you could go down to examples in, say, primary health care centers, or if you want to look at the tertiary institutions, or other forms of healthcare administration within the country.
Yeah. Oh yes. There are a lot of key digitization projects going on in the country, even on the continent generally. In Rwanda, I know that the Gates Foundation are sponsoring something around AI in primary healthcare. So AI digitization for frontline workers, which is something that started I think 6 or 8 months ago and is still in pilot phase. But I'm going to speak more to the ones that I'm very much hands-on in, and how that those are helping to shape and improve healthcare delivery in Nigeria. One of them is having like a digital enabled primary healthcare centers in Lagos State. And this is a project that had started since 2022, I would say. But sometime in 2023 ending, we got some support from Bill and Melinda Gates Foundation then, before they, rebranded to the Gates Foundation, to ensure that these primary healthcare centers move from in the first they moved from a paper-based practice to digital operations, right? And we had all of the challenges I mentioned earlier, at the hurdles that we've had to, go through, the facility politics, in fact, even the adoption rate of people, the education we have to re-educate and re-educate people, to ensure that they understand these things. It will interest you to know that a large percentage of the healthcare workers working in the healthcare space have no idea about how to use computers. They have no digital literacy. So you literally have to start, training them on digital literacy before you even move on to, you know, your system in the first place. So with that, in terms of impact, I would say that has seen in the 102 facilities that are currently digitized and using end to end, that has seen these facilities move from a paper-based system to offering like end to end services digitally, and that's also saying so patients can now book appointments before prior to coming to the hospital. So people don't really have to go to your facility to queue up, as what the case would be, right? And in terms of data for decision making, that project in itself, as we speak, has over 500,000 patients enrolled, which means that in terms of universal health coverage, this is a huge contribution to that, right? This is a huge contribution to that, And another digitization efforts I touch on is the SHIP project, which I mentioned.
Yeah.
It's supposed, yeah, it's a, an health information exchange platform, mainly sponsored by InterSwitch. So I think InterSwitch has like a contract with the Lagos State government to build an health information exchange platform that integrates every healthcare system within Lagos State together to ensure that each patient have access to one record. What that means is, once if a patient is registered in a primary healthcare center that is powered by Thalamus, for example, and the patient needs to be referred to a general hospital, that patient would not need to be registered all over again. The patient's medical records can travel with them wherever they go, you know, at the end of the day.
Yeah.
And this is also something that the federal government of Nigeria, is looking at replicating across the country. There are also a lot of digitization efforts from the federal government level as well to ensure that the architecture and the policy, of how this information exchange is going to happen are in place, right? So say for example what kind of information are mandatory to collect for during registration of a patient. Right now, what is applicable is Helium Health, for example, will have a different ways or a different method of registering patients than Thalamus Health, right?
Yeah.
Or a Movie Health or Zuri Health or whatever it is. So what this is doing is ensuring that there is that unified language. So if all of the systems can speak, like similar language. I mean, this doesn't necessarily mean that you that have your system already built out have to kind of modify anything. I'm sure with technology there's a way that you can have a layer that converts whatever it is you have to fit, the what the standard should be. But these are like some of the some examples of these digitization projects that are going on. There are also a lot of pilots for telemedicine going popping up all over. I think this has been a trend that started from 2020. Of course,
Hmm.
because of COVID-19, the need for people to access care, and then the challenge of them not having to they could not go to the hospital physically because of that restriction, right? So there are a lot of telemedicine projects coming, a lot of companies coming, or a lot of startup, piloting telemedicine projects in primary healthcare centers, in private hospitals, you know. So digitization or digital health is still, I would say, in its I would say it has moved from an early stage, to a stage where a lot of people are now seeing the need for it, and a lot of people are now building, around some of these gaps and some of these challenges existing in this space.
Okay. Um, you know, Femi as well, like from early stages as well, we've always heard about interesting projects being done. Some of it purely government driven, most of it private sector driven, and a bunch of it public private sector partnership, right? And from the outside, from the eye side, it still looks like very little progress has been made, right? And the question is, why is it so? And is anybody benefiting from the healthcare system in Nigeria specifically being broken?
We have to be very careful with things that we say before DSS calls to my door. So I'm going to keep the is anyone benefiting, from it, out of it, and give you some practical examples for something that we've seen, right? And why it looks like why does it look like a lot is being done, but a lot of progress is not. We are not making a lot of progress. Let me give you an example. This still ties back to people's motivation,
People
right?
problem.
What motivates people to work, right? So I think it was last year or early this. I think it was last year. It was last year when the United States government cut fundings for HIV support, PEPFAR, right? And when that happened, the entire federal government, the entire federal Ministry of Health, with all of the state Ministry of Health, were thrown into disarray. Why? Because majority of the health budget or majority of the budget that they receive comes from this foreign aid. And when that foreign aid was no longer coming, that was when our leaders started thinking about, oh, we need to have why will a decision that is made in the United States affect us so much? We need to ensure that we have data sovereignty. We need to ensure that our information are domiciled here in Nigeria, as opposed because how this works is it is not just the funding, right? The funding is there, but there's also a technology solution that is deployed to ensure that patients are registered on. And this information or this data that is being gathered, it doesn't sit in Nigeria. It goes back to where the funding came from in the first place. But when this happened, there was a meeting that called all of the innovators in the healthcare space together to say, okay, how can we, how can we ensure that we have, oversight on HIV patients in the country? How do we ensure we have a system that is efficient enough that we have this data domiciled on our systems, and then we can provide this information to anybody who needs it at the end of the day, and we'll be in charge of it and in control of it, right? Started that conversation, but immediately funding came back. That conversation had gone cold. It's now back inside inside the folder where it came out from. You understand? So it still boils back to the motivation, right? This funding is back, and then things can go back to being business as usual, right? And we don't really care about if it affects the people or not, or who gets the data or not. At the end of the day, we are getting our funding from it at the from what we need. I'll also give you another example of some deal we're trying to close with Ghana Health Services. right? This is a project that we have been on for, I think, since 2023 or so. And then we got to the point of, signing MOUs and agreeing and moving forward. And then we're told that, well, we do not have, I don't think we have the funding right now to be able to fund, this laudable solution that you want to bring in. But what I think is we can look at a pool of donors, right? Look at that donor pool, look at who we can get funding from, and ensure that we have enough funding to have you digitize this. But what the caveat is, whatever it is that you are building has to provide value to the donors. I don't know if you get where I'm going to with this, Charles.
Yeah.
You have
Yeah.
to you have to provide value to the indicators that these donors, if they have an agenda to maybe oversee a particular disease, for example, that is what their funding is going to be for. And you have to modify your system to ensure that you give them oversight over that particular disease. You understand? Even though that disease might not be the prevailing disease in that particular environment, if you know what I mean. So there are a lot of projects. There are a lot of projects coming up. There are funding coming into the space for healthcare delivery. But at the end of the day, it is still business driven. It is still how can I how can it is not it is more on the business part than on the patient part. If you get what I mean, right?
Yeah. Yeah.
Yeah. So
Okay.
so so even though it seems like a lot of work is being done, we still have to get to the point where healthcare itself can provide revenue to power itself without having to look for external. I don't know if you get what I mean.
Yeah. 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 Okay. And even to be fair, even in advanced countries, they are constant hospitals are constantly looking for funding. But again, I understand your analysis here. And one question that is important to me is, and to me, it does feel like the Nigerian government specifically, and lots of places in countries in Africa also do this as well, where it feels like we are all focusing on the big break in healthcare and other agencies as well that are not healthcare, as opposed to incremental progress. What is your thoughts
Yeah.
on that?
Oh yes, 100%, 100%, and it is from. I think it's a culture from the top. Even your national budget, majority of the national budget is funded by foreign investors or Gavi Alliance, the Gates Foundation, PEPFAR, and the likes. So it's just unfortunate, and the sad thing is, when these monies come in, the people who are actually there to solve the problem don't have access to it. This fund They don't have access to this funding. At the end of the day, someone can do an accelerator program and say, "You guys will come, bring your idea together," and after that program, that is it. No, it doesn't translate into, as long as you've gotten the information your investors or your funders need, you've given it to them, the project has closed, that is it. There is no continuity. So that is the reality of where we are, and I'll say you're spot on with that statement.
Okay. In your opinion, Femi, how do you think we make real progress here in healthcare? And I know that this is somewhat of a broad question because there are so many aspects to healthcare, but you can maybe bring it
Yeah.
down to an area that is important to you or that you're so connected to, and you decide how to take the question. But I'm trying to
Yeah.
understand from your perspective, how do you think we can make real progress in this space?
So progress is not standalone. I think how progress can be made. I'm going to be speaking from the digital health standpoint, right?
Yeah.
And the first way in which we can make progress is by partnership, right? This is still in the private market now, right? There are a lot of private players who are building, I don't know the word, like something that's already been built, and then somebody's building it again, without even knowing that someone else have already built something very similar. Do you understand?
So
So there are a lot of
there's repetitive
duplicity of
solutions in the
efforts.
market.
Yes,
Yeah.
there are a lot of repetitive solutions. There are a lot of duplicated efforts. And even in cases where they are not a carbon copy of another company, whatever information they are gathering is siloed, is domiciled to their own system. So there is no interoperability between systems, right? So to make real progress, there need to be that communication. And private businesses themselves, there's only so much that they can do, right? So partnership also extends to government. So they have to be public-private partnership to facilitate these things, right? To facilitate how this information are going to be exchanged, to facilitate, to ensure that the guardrails are there, to ensure that there are no predatory deals, to ensure that data is being used in the most ethical way and all, right? So I think the way forward would be partnership between private organizations, partnership between private organizations and governments, and then from there, I'm hoping that those partnerships is going to help to provide that railroad for information to be for information to move, right? Because right now,
Yeah.
every information just ends somewhere. There are a lot of deadlocks, in the industry. So someone who is in Abuja, for instance, who moves to Lagos, their information or their health record do not move to Lagos with them. It's domiciled in Abuja. Even if the facility is using a tech solution, it is still on their own servers over there. Yeah, at the end of the
Yeah.
day. So make real progress. Those real roads has to be there to ensure that there is that communication. I mean, look at finance. We can draw examples from fintech, right? There's NIBs that ensure that you know transactions from GTB and Zenith Bank can happen. Healthcare don't have that,
Yeah.
and this is Nigeria, and then this applies across Africa. So for real progress to be made, they need to be those railroads and then the guardrails to ensure that information exchange is done in the most ethical way.
All right. And I think, what are you optimistic about, the future of African healthcare, with all of the conversation? Are you optimistic about it?
Optimistic, oh yes.
Do you want to tell me a bit more
Yeah.
about why?
I mean, that's because that is stemming from my kind of person. I'm naturally a half glass full kind of guy.
Hmm.
So I always see the positive part of things, right?
But I mean,
But
but
from my
beyond your
experience, yeah,
okay,
but
okay.
but from my experience, yes, but from my experience over the last 5 years, we've made progress, right? Slow
Hmm.
progress, but significant progress, right? So I'm
Hmm.
still optimistic. You know, I mentioned earlier that there are a lot of. I mean, I'm going to draw example from the state of health tech in Nigeria report, right? Between 2004 and 2019, there are about 60 startups in healthcare, but within 2020 and 2026, there are about 64. So if you look at that, it tells you that there are a lot more people who are seeing these gaps and coming into the space to close these gaps. And in terms of funding, from 2022, 2023 was the darkest year for health tech because funding actually dipped. But from last year, there are a lot more projects coming up. There are a lot more funding coming into the space, most especially with AI, right? Healthcare in AI. People are more excited about how AI can be implemented, to solve some of the problems of patient education, of overburdened healthcare workers, of clinical decision support, of disease surveillance and emergency response. So all of these things now, are garnering a lot more interest. But of course, before we can even have any AI powered system, we need to ensure that those railroads are in place, right? But looking at all of this and looking at the pattern, the trajectory, I would say I'm very optimistic that we just need a lot more smarter people in this space, and we need a lot more young people. I will tell you that for every meetings that I've been in, I would, if I'm not the youngest person in the room, I'll be in the top 5 or top 10. So we need a lot more
Interesting.
young people. Yeah, a lot more young people in this space. You know, that can bring in fresh perspective, that can bring in perspective, because at the end of the day, it's these people who are going to maintain whatever the old folks build. Is the young guys that are going to maintain it. That if
Yeah.
if it if it leaves and to stand the test of time at the end of the day. So we need a lot more young people in this space, and once that happens, healthcare becomes cool. You know, a lot of people might can also come into it.
All right, final question today before we go for me. So, if you're given total control of our healthcare system for the next 5 years, what is the first thing you would kill?
Are we kill?
Yeah.
Okay, so I will start this from what the ideal should be. In ideal societies, people do not rely on private healthcare delivery. They rely mostly on the public infrastructure, right? So, and for these public facilities, whether primary, secondary, tertiary, they are lacking on it. Primary especially, right? It's really an eyesore. So what I will kill what I will kill is that whole bureaucratic process in the public space. Let me give you an example. I have a project. I want to train you on, how to use a particular system. And then I have to lodge you in Radisson Blue for 3 days and have a workshop and pay you attendance fee. And, so if I got like $2.2 million in funding for a particular project, $1.2 million goes into operational costs, running costs, for training, for this, for that. So for me, I would say that is if I was in that position, I'm going to clock that, because that $1.2 million would go a long way into providing real solutions as opposed to the optics, the paparazzi, the workshops, and all of those things. So for me, I, from that, there'll be more. If even if even if it means like paying healthcare workers more money, it will go a long way. Healthcare workers will be a lot more nicer. You don't want to know what pregnant women go through in primary healthcare centers in Nigeria, because the healthcare workers themselves, they don't get joy. Do you understand my point? So that is, for me, that'll be like the first thing I'm going to take out. They have to be like a very efficient way to work. All of these bureaucratic processes of, oh, you have to do this to do this, you have to do this to get here. No, these are things that we're in 2026, for Pete's sake. You can train people online. You can train people on the go. You don't have to do things just because that's how it has been since the 1990s. You understand my point? So for me, that'll be the first thing I'm going to, and it applies everywhere, not just Nigeria. It applies everywhere. You have funding for something, and majority of that funding goes into operations, and maybe like 10 or maybe like 20 to 30% of the funding actually goes into the project itself, like in terms of the core of the thing that powers the project. If you know what I mean. Yeah. So that, I think I'll stop it here.
All right. Thank you so much for being with us today, Femi. I really appreciate it.
Thank you, Charles. Wonderful conversation.
Was it? All right. It's easy to admire progress once it arrives. What's harder is appreciating the work that made it possible, the
Yeah.
coordination, the persistence, the people willing to keep pushing long after the excitement has faded. Maybe that's why meaningful change often takes longer than we expect. Thanks for listening, and I'll see you in the next episode.